You are on the next level. This is The Beautiful Truth, where the expression is still free.
10, 9, ignition sequence start. 6, 5, 4, 3, 2, 1, 0. All engine running. Liftoff. We have a liftoff.
And you are very welcome. This is The Beautiful Truth on breakfornews.com with Fintan Dunn reporting and continuing to debunk the hysteria around COVID-19. We're going to focus on the actual number of people who die and focus on the figures which have been quoted and bandied about in the media. Highly misleading. And we're going to unpick that. And you'll finally understand what this is all about when we've done it. Going to do that with the help of not my suppositions on this, with some medical experts of huge international import. In particular, we're going to listen to this guy here, Professor Neil Ferguson. Neil Ferguson is, I'll give you an FT, Financial Times report on Neil Ferguson and their institute, Imperial to set up disease research centre with Saudi support. The Jameel family in Saudi Arabia have funded an institute which is looking into this, and Professor Neil Ferguson belongs to that institute. The Imperial College London he's part of, and his specific task is to look into these issues. So let's have a little listen to him about how many people who get this disease actually die. Is it really 3.4%, which the World Health Organization says it is, or is it lower than that? 3.4% would be 34 people out of every 100 dying. 3.4 people out of every 100 dying.
It might be worth just saying that every time we detect a death, there's probably 1,000 undetected cases behind that death. The reason for that is that we think epidemics, in the absence of control measures, which is what we're talking about earlier in Italy, probably double every 5 days or so, and only about 1 in 100 people infected die. And so the deaths we see today, it takes 20 days or so from when somebody develops symptoms to when they die. The deaths we see today correspond to the epidemic 20 days ago in each of these countries. And that gives you, the epidemic must have been about 10 times smaller then. And then you multiply that by a kind of factor of 100 in cases to deaths. You get about a 1,000-fold multiplier.
You get about a 1,000-fold multiplier, which means that 0.1% of people who get this would die. Not 3.4%, but 0.1%, which is 34 times less. What's going on here? Let's just check out some more on this. The World Health Organization on March the 3rd, which is only 6 days ago, told the world that 3.4% was the mortality rate estimated by the WHO. Let me give the opening remarks in a March 3rd media briefing. Globally, said the WHO, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected. Now, far fewer than 1%. Dr. Fauci said it's not like far fewer than 1%, it's 1/10 of 1%. That's an order of magnitude less, not far fewer. So how do we reconcile this 3.4% and Dr. Fauci's comments of 1%? Let's just take a look at some more on this. I'm going to quote you from another expert now. And this is Dr. Anthony Fauci. This is from the New England Journal of Medicine, published at the end of February. And an article by Anthony S. Fauci and others. Who's Anthony S. Fauci? He's only the director of the National Institute of Allergy and Infectious Diseases in the United States. He is the top honcho in the United States when it comes to this stuff. And what did he write? What he wrote back at the end of February now, so like nobody can claim they don't know about this. He wrote this. If one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases, which is a reasonable assumption. There's a lot more people out there who had it and had no symptoms compared to people who had significant symptoms and showed up at hospital, right? He says if that's the case, then the case fatality rate may be considerably less than 1%. This suggests that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza, which has a case fatality rate of approximately 0.1%, compared to, say, SARS or MERS, which had case fatality rates of 9 to 10% and 36%. So, you trying to get your head around this one? Well, the New York Times reported those comments, so these are significant comments. As the New York Times reported, the true death rate could turn out to be similar to that of a severe seasonal flu, below 1%, according to an editorial published in the journal by Dr. Anthony S. Fauci. Below 1%. He didn't say below 1%, New York Times. He said 0.1%, an order of magnitude lower than 1%. When it's so important to be precise, how the hell are these figures ending up in media, and what the hell do they mean? Remember now, you've been scared shitless a number of times by SARS in 2003, avian flu in 2005, swine flu in 2009, West Nile virus in 2012, Ebola in 2014, and Zika in 2016. And did any of these diseases wipe out the earth? No. They didn't. Which is why people like this guy put up a tweet on the internet, which is now being widely criticized. The tweet he put up was, virality of C19 is overstated due to conflating diagnosis date with contraction date and over-extrapolating exponential growth, which is never what happens in reality. Keep extrapolating and virus will exceed massive known universe. Who is this dummy? Elon Musk. Oh yeah, I remember him. He's some guy who puts rockets up in the air and all that kind of stuff. Yeah, some dummy. Who wants to listen to this guy? Just because you can launch rockets and build electric cars and stuff doesn't mean that you can actually use your brain to second guess what's going on in the media. And he's been rightly and roundly criticised for daring so to do, as we near now 111,000 cases and 3,889 deaths. One reassuring thing, though, let me just magnify this for you. There's a little graph, and this is from Off Guardian, an article by Kit Knightley, which I recommend that you read, and I'll link it in the various links we have here. But that green line is the recovery rate, and that brown line is the death rate. Look at the recovery rate and look at the collapsing death rate. Now, to sum up, Knightley writes, according to official estimates, every day for over 2 weeks, this is a week ago now, fewer people have the disease, a smaller percentage of people are dying of disease, and more people are recovering from the disease. Nobody in media is talking about this. Instead, we constantly see coronavirus cases reach 95,000 without adding the corollary that 54,000 of these people are already better. It's a good criticism, isn't it? And I'm going to now just cut through the fog for you and explain how this should be reported. You see, there's a difference between case fatality rate and fatality rate. Fatality rate is how many people who got the virus ended up dead. That's fatality rate. It's fairly straightforward. Case fatality rate is how many people who showed up in a hospital and were confirmed to have the virus died of it. That could be quite different. Let me show you how. Let's say it's day one of a brand new virus that we've never seen before. Okay? And on that day one, somebody shows up in hospital desperately ill. They test them, they find there's some new virus there. Within 24 hours, that person is dead. First ever case, first ever realization that there's something out there. What's the case fatality rate? You're ahead of me. The case fatality rate is 100%. The following day, somebody else comes in with the disease. They don't die. In fact, they recover within 24 hours. What's the case fatality rate now? 50%. The next day, somebody else comes in. They're okay too. What's the case fatality rate now? You see, the number of people showing up is driving the case fatality rate, and it can start at 100% with the first. But 9 months later, when all the data is calculated and it's all sort of played out, is when you can finally get to the figure which shows you how many people died compared to got infected. And that's where the figure of 100% on day one as a case fatality rate turns into a fatality rate in the long term of how many people actually died. So you start with 100% and you end up with 0.1%, 0.1%. Now the problem is that what they're throwing around in media all the time are these case fatality figures. And the truth of it is that you can't isolate and you can't determine what the actual fatality rate is, not for anything. Let's go back to Dr. Anthony Fauci's there again, and where he writes that severe seasonal influenza has a case fatality rate of approximately 0.1%. Will you make up your mind whether you're looking at the total number of cases that we are extrapolating and actual cases showing up in hospitals? See that it's getting mixed up all the time. Going back to that WHO report, where did I have it? WHO. Yeah, here we are. Let's just look at that statement again there now. And you'll see how the WHO has conflated the two different figures into one sentence. Globally, 3.4% of reported COVID-19 cases. You see, this is the strict medical case fatality rate reported. By comparison, seasonal flu generally kills far fewer than 1% of those infected. Not only is that misleading by a factor of 10, it's 0.1%, but that's a total fatality, not a case fatality. That's not based on how many people show up in hospitals. That's based on how many people die out of how many people got the disease. So he's using two different sets of figures in the one sentence. And that's why you have, on the one hand, somebody talking about a 3.4% mortality rate scaring the shit out of everybody, when it turns out the actual rate is 0.1%. Okay, that's my first video for today. And I'm going to do another one. I'm going to do another one which raises some interesting questions. And it will focus on the issue of whether there are, in fact, two different diseases out there. Two different strains of this virus. And I'll be back soon with that. If you'd like to get notified of it, just click the subscribe button and ring that bell to make sure you get notified of the next video. All right, that's it for now. I will be back with more, but in the meantime, for breakfornews.com, this has been Fintan Dunn reporting. Thanks for joining me.